cardioverter defibrillator to prevent a repeat cardiac arrest. And this is just a small device that's surgically placed under the skin in your chest or abdomen and uses electrical pulses or shocks to help control dangerous arrhythmias. So talk to your doctor about ways to prevent death due to sudden cardiac arrest. If you're a Loveless member and need assistance after a heart attack or cardiac arrest, please call us. The number is 1-800-390-9159 to speak to a health coach. And this is a free service provided to all Loveless members. And one more time, that number is 1-800-390-9159. So now moving on to cancer. In 2006, the most recent year for which statistics are available, more than 700,000 men in the United States were told that they had cancer, and more than 290,000 died from it. Due to advances in early detection and treatment, more men who are diagnosed with cancer are surviving each year. Cancer is a disease in which abnormal cells in the body grow out of control. And the four most common types of cancer among men are skin cancer, prostate cancer, lung cancer, and colorectal cancer. So skin cancer is the most common form of cancer in the United States. The two most common types of skin cancer are basal cell and squamous cell carcinomas. These two types of skin cancer are highly curable. However, melanoma, which is the third most common type of skin cancer, is much more dangerous. And in 2006, more than 5,000 men in the United States died of melanoma of the skin. Most skin cancers are caused by exposure to ultraviolet light. And the best way to avoid skin cancer is to protect your skin from the sun by using sunscreen, staying in the shade, wearing sunglasses, wearing a hat, and wearing sun protective clothing. So again, if you're a Loveless member who's faced with making a decision about skin cancer treatment, or you need more information about skin cancer, we can be reached at 1-800-390-9159. So moving on to prostate cancer. When cancer starts in the prostate, that's when it's called prostate cancer. And it's the most common cancer in men in the United States, not counting skin cancer. It's the second most common cause of cancer death in men. While men are at risk for prostate cancer, some factors increase the risk. And these include being 50 or older, having a family history of prostate cancer, and then being African American. According to the Centers for Disease Control and Prevention, in 2006, over 200,000 men were diagnosed with prostate cancer, and over 28,000 men died from it. There's no real way to know for sure if you'll get prostate cancer. Different men have different symptoms for prostate cancer, and some men don't even have symptoms at all. Some possible symptoms of prostate cancer are difficulty in starting urination, weak or interrupted flow of urine, difficulty in emptying the bladder completely, having a pain or burning sensation during urination, blood in the urine or semen, frequent urination, especially at night, painful ejaculation, pain in the back, hips, or pelvis that doesn't go away. So if you have any of these symptoms, you should see your doctor right away. But also keep in mind that these symptoms may be caused by other health problems, so don't panic. And then there's no, in the same way that there's no way to know for sure if you'll get prostate cancer, there's no known way to prevent prostate cancer. But researchers are trying to find ways, and some of the factors under study right now include vitamin and herbal supplements, foods that are high in animal fat, physical activity, hormone levels, and environmental agents. So when someone undergoes cancer screening, it means that their healthcare provider is looking for cancer before it even causes symptoms. So tests that are commonly used to screen for prostate cancer are prostate-specific antigen test, also known as a PSA. PSA is a substance made by the prostate, and the PSA test measures the level of PSA in the blood, which may be higher in men who have prostate cancer. However, other conditions such as an enlarged prostate, prostate infections, and certain medical procedures can increase PSA levels. So again, that test is not 100%. Another form of prostate cancer screening is the digital rectal exam. A doctor or nurse checks the size and shape of the prostate manually. So not all medical experts agree that screening for prostate cancer is right for all men. Prostate cancer screening has potential risks as well as potential benefits. The potential benefits of prostate cancer screening is finding cancer early, when treatment may be more effective. However, potential risks include false positive tests, which is when the test says that you have cancer, but you really don't, and therefore treating prostate cancer that may never affect your health, and then the side effects from prostate cancer treatment. The U.S. Preventative Task Force finds that there's not enough scientific evidence to decide if prostate cancer screening is beneficial for men younger than 75 years old, and recommends against screening in men over 75. So the U.S. Preventative Task Force suggests that men discuss the benefit and risk of screening for prostate cancer with their doctor. So now moving on to lung cancer, more men in the United States die from lung cancer than any other type of cancer. So about 9 out of every 10 cancer deaths in men in this country are due to smoking. Tobacco is the leading preventable cause of disease and premature death in the United States. The most important thing you can do to prevent lung cancer is not to start smoking or to quit if you do smoke. You can also reduce your risk of lung cancer by avoiding other people's smoke and testing your home for radon. By not smoking and avoiding secondhand smoke, your likelihood of developing this disease is exponentially decreased. Each year, nearly 200,000 people in the United States are told they have lung cancer, and almost half of them, so 90,000 people die from this disease. Research has found several causes and risk factors for lung cancer. A risk factor is anything that changes the chance of getting a disease. And lung cancer risk factors include smoking, secondhand smoke from other people's cigarettes, radon gas in the home, things around your home or work, including asbestos, ionizing radiation, and other cancer-causing substances, medical exposure to radiation to the chest, chronic lung disease such as emphysema or chronic bronchitis, and also increased age. So you can reduce your risk of developing lung cancer in several ways, and the number one way is to not smoke, and if you do smoke, to quit. The second is to avoid secondhand smoke. So there's no risk-free level of secondhand smoke exposure, period. The third is to have your home tested for radon and take corrective actions if high levels are found. The fourth is to avoid unnecessary medical tests that involve X-ray images of the chest. And the fifth is to follow health and safety guidelines in the workplace. So different people have different symptoms of lung cancer. Some people don't have any symptoms at all when first diagnosed with lung cancer. Lung cancer symptoms can be due to the direct effective growth of cancer cells in the lung, or due to the effect of cancer cells that have spread to other parts of the body. Lung cancer symptoms due to growth of cancer cells in the lung may include shortness of breath, coughing that doesn't go away, wheezing. It can also include coughing up blood, chest pain, repeated respiratory infections such as bronchitis or pneumonia, and these symptoms can happen with other illnesses too, so talk to your doctor if you have symptoms that concern you. Lung cancer is treated in several ways depending on the type of lung cancer and how far it has spread. Treatments include surgery, chemotherapy, and radiation. People with lung cancer often get more than one kind of treatment. And people with lung cancer may also want to take part in clinical trials. So clinical trials study new potential treatment options. And people who have been tested for lung cancer may continue to have symptoms caused by the cancer or by cancer treatment side effects. People who want information about symptoms and side effects should talk to their doctors.